I am Bill Henricus, an emeritus professor of orthopedic surgery at Penn State College of Medicine, and currently practicing on an extended global health surgical medical mission trip with my wife Eileen in the southern Filipino island of Mindanao. My history with Dr. Al Crawford began in the early 80s. I was impressed, as well as every resident, with his incredible charisma, his teaching ability, his surgical ability, and in addition, he was a phenomenal tennis player. He took a few of the residents and faculty out and taught them a lesson or two on the tennis court. And one night on a social event, I think it was a clarinet, he pulled out an instrument and he started playing, and he was a phenomenal musician. A few years later, while I was still in the Navy, he invited me to visit his practice in Cincinnati. I spent 2 to 3 days. I observed him in the OR, observed him in the clinic. And then at that time, he was doing some research and writing on endoscopic spine surgery. So he brought me to his laboratory, and he had an animal lab, and we worked for 4 hours together on a pig. And he taught me how to do endoscopic anterior spine surgery with discectomies and spinal fusions. His generosity and kindness was phenomenal. A year later, he wrote me my mentor support letter to join the American Academy of Pediatrics and became a fellow in the AAP. And the AAP has been a very important organization, just like the AOA, during my career. Just as Dr. Crawford has mentored and inspired me, he has committed himself to the development of the careers of many young orthopedic surgeons around him. And he's reached out to orthopedic surgeons such as myself to help us. In addition, he's trained hundreds of orthopedic residents and fellows to become better orthopedic surgeons for their communities. Not all of them became pediatric orthopedic surgeons, but every one of them was touched and improved by their rotation or experience working with Dr. Al Crawford. In my opinion, Dr. Crawford epitomizes the definition of an AOA pillar of the orthopedic profession. And indeed, even today, decades after I first met Dr. Crawford, he continues to help me and inspire me in that the residents I'm training now in the Philippines are being touched in an indirect way by the education and the teaching Dr. Crawford gave me. As one example, I've utilized at least 15 articles of the over 100 articles Dr. Crawford has published in his career. And those 15 articles I've utilized here in the Philippines during the past 7 months for patient care and for teaching for the multiple residents that I've trained during my time here.
My name is Keith Gabriel. Although now retired from clinical practice, I continue academic participation as an emeritus professor at Southern Illinois University. I've known Alvin Crawford for about 37 years. Along the way, I did my pediatric fellowship with Dr. Crawford in 1986, 1987. It was an intense year. Since then, Alvin has been my very steady professional mentor and personal friend, as indeed he is to all of his 78 former fellows. Dr. Crawford has had an exceptional career as an academic pediatric orthopedist. His curriculum vitae, easily accessed online nowadays, includes numerous publications, visiting professorships all over the world, recognition as an authority on neurofibromatosis and innovative spinal deformity correction, memberships in pediatric orthopedic and orthopedic spine organizations, and leadership positions such as presidency of the Scoliosis Research Society. Dr. Crawford is a technically gifted surgeon. As his fellow, I heard him say that he wanted to do more of every procedure than anyone else. Although that might not have been realistic, Alvin certainly did lots of procedures and reported his work honestly. Importantly, he practiced in Cincinnati since 1977 and has continued to see his own patients even as they've grown into adulthood, affording him a 40-year credibility that very few of us can boast. Also a sign of our times, Dr. Crawford's personal history is easily available online, and I have perhaps heard additional reminiscences in more private settings. Suffice it to say that Dr. Crawford has been a pioneer for diversity. Pioneer, not simply an explorer, in the sense that he made and continues to make things easier for others. His history inspires, his participation in relevant organizations sustains, and his contributions support medical school scholarships. If Alvin ever did have a chip on his shoulder, it has never shown. Each challenge has been surmounted with grace. It is what it is. Dr. Crawford has always been a fierce competitor on the tennis court, known for winning West Coast U.S. Navy championships and for being nearly unbeatable in the afternoon contests at pediatric orthopedic meetings. He has an undergraduate degree in music as a clarinet major. Alvin was always great at sight reading, and his name can be found as a sideman on Memphis jazz recordings in the late 1950s and early 1960s. He continues this avocation even now, playing clarinet with the Queen City Orchestra and teaching jazz history there in Cincinnati. He's been married to Alva Jean for about 60 years. They have 2 children, and Alvin is nothing but putty in the hands of their 3 granddaughters. Thank you. I'm absolutely delighted to offer this shout out for Dr. Alvin Howell Crawford, truly a pillar of our orthopedic profession.
I'm Alvin Crawford. I'm doing this video for the Pillar Award that's being bestowed. I am Professor Emeritus of Pediatrics and Orthopedic Spine Surgery at the University of Cincinnati College of Medicine and an assistant in jazz history in the College Conservatory of Music. I have trained over 57 domestic and international postgraduate fellows, hundreds of rotating residents, allopathic as well as osteopathic learners. But upon my retirement, the Scoliosis Clinic at Cincinnati Children's Hospital was dedicated as the Crawford Spine Center. For 49 wonderful years of 27,410 interventions, families allowed me the opportunity to take care of their precious children. During my best days, to say I was demanding was an understatement, but to say I was caring, compassionate, and empathetic, and would work harder and longer than any other human being was a reality. First, I'd like to express my extreme gratitude and thanks to my co-champions. These are former trainees, Keith Gabriel, seen here in Navy uniform, and Bill Henricus, seen with his physician wife in the Philippines on a medical missionary trip. They recruited and convinced others to support this honor, but I'm even more honored that they elected to pursue the wonderful field of pediatric orthopedics as their life's work. I'd also thank my wife of 59 years and family, as well as Jack Howard and Art Pappas, an AOA pillar, who was responsible for me being allowed to train at Harvard Medical School. Miran Otajian, Ed Miller, who was a University of Cincinnati orthopedic chair who hired me as pediatric service chief, but also Dr. Otto O'Frank, Bob Winter in spine, as well as John Hall, Dean McEwen, and Dennis Lyne. When I think of locally, Aaron Perlman and Bill Schubert, they were instrumental in what I've been able to do in this life. But in addition, my social political mentors were Charlie Epps, Raymond Pierce, and Augustus White. As president of the John Robert Gladden Society, I presided over the highest attended meeting of orthopedists of color with a combined Caribbean Orthopedic Society and the John Robert Gladden Society. Lastly, I was a recipient of the 2007 AOAS Diversity Award for my commitment to increasing diversity, that's men and women, in the fields of orthopedics. I've shared a photo of my female fellows performing spine surgery in what I call a testosterone-free zone, in that I was the only male that walked into the room and out, but only to take their pictures. Now, recent statistics show that our field currently is the whitest and least diverse of all U.S. surgical subspecialists. Now, experts feel this trend could exacerbate racial health disparities and doctor shortages. African American men lag behind, even as other male minorities and women continue to gain greater representation amongst medical school applicants and students. 2 years ago, I started Black Men in Medicine Cincinnati, a mentoring group of African American male medical students. This is a diminishing, underrepresented, and at-risk group. Our mentoring efforts are cross-cultural and open to all genders. However, the critical issue of Black males are our focus. The mentors work with the students and serve as example of you can be what you can see. And this is our mantra that we depend upon and we express to the students. Now, as a musician, surgery and music have tremendous overlap. To achieve surgical success in an operating room, then the OR team, the surgeons, the nurses, the technicians, the anesthesia, they must work in harmony and all work together. But if you're a pianist, to achieve success in any piece, then you must be able to play the black and white keys together to be successful. Now tell me, is there not a message here? Let's look at leadership and the message I'd like to leave to trainees. Number one, goal setting. Set yourself the highest goals. It is not a matter of setting goals too high and not achieving them, but perhaps setting goals too low and achieving them. Number two, learn to listen. Listen. Listening is an art. It's amazing what you can hear by listening. Now, God gave us only one mouth but 2 ears to allow us to hear better. Remember, the ability for you to listen and hear is much, much better if your lips are not moving. Lastly, at the end of learning, questions always arise as to how to best treat certain human beings. Quote unquote, they may say the dirt bags, the underrepresented minorities, the unwashed, the offensive, the odorous, the obnoxious. All of these are just names, but those you want to know, well, how do I do my insurance paying private patient who steps into my office? Well, that's not the story. And the solution is easy. It is extremely easy and not a problem. When one continues to exercise the F-square principle, and this should be exercised to every human that you encounter. The F-square principle is that you would be willing and able to treat them as though they were either family or friends. To me, this is an unbelievable opportunity that I've been given to be able to be a part of this and to get this type of recognition. And I would really comprehensively want both Keith and Bill to know how much I appreciate this, but also to those individuals that were reached out to who responded so well to this, to be aware as to how appreciative I am. They know how much I've respected them and how we've interacted in the past and in situations. However, this to me is the penultimate of what I've been given. And it's because of people like all of you who've been involved in this, who've done this, for me to be able to have this. And I love the opportunity to share with you.